Welcome to the Fatty Liver Docu-class. I'm your host, Jonathan Landsman. For over 30 years, I've been in the health and fitness industry, creating over 500 programs with over 300 of the world's top experts in integrative health and science. And I can tell you without a doubt that poor liver health is directly and strongly connected to autoimmune disorders, cancer, diabetes, dementia, heart disease, and even skin issues and thyroid problems. That's why I created this event, so you can gain a greater understanding about how poor liver health increases your risk of future health problems and, more importantly, what you can do to avoid unwanted pain and medical expenses. This event is filled with life-saving information and solutions you won't find anywhere else. So let's get started. Today, you're about to meet 4 extraordinary people with one inspirational message. You can completely get rid of the threat of fatty liver disease naturally, and it's easier than you think. For example, our first expert, Dr. Burt Benson, has been reversing serious liver conditions for decades. Yet as shocking as this may sound, despite his success, Western medicine largely ignores what he has to offer. Dr. Benson will reveal how he is able to help people regenerate and repair liver function without the need for toxic medications. In addition, you'll discover a simple and inexpensive treatment for stage 4 cancer that has conventional oncology furious, and a shocking drug company admission that reveals their true agenda. It's worse than you can imagine. Please listen carefully to what you're about to hear. So, you're fired from the FDA after 23 years. That's one thing that we got to talk about. Number 2, you're ordered to give a woman something that she's allergic to. You refuse because it's not the right thing to do. They get some other doc to give it to her. She dies. And then they want to pin it on you. And that's just the beginning of that story. And third, we got to hear from you about this. You're in internal medicine in a hospital. You're helping people, or you're not supposed to do anything but take notes, I should say, for these people who are going to die because of liver problems. Instead, you help them, and all your peers around you just have the worst attitude against you. Dr. Benson, you got to tell me first about the FDA. You're there 23 years and they fire you. What's going on here?
Well, it's a long story. I took care of these people who were considered end-stage liver disease. I was told they'd be dead in 2 weeks. I was told to watch them die and take notes, present it to grand medical rounds in 2 weeks when they die. Rather than doing this, I called the National Institutes of Health and spoke to Dr. Fred Barter, who was the chief over there. And I asked him if there was anything in the world that would regrow a liver. And he said he was studying alpha-lipoic acid as the wonder drug for the reversal of diabetes and diabetic neuropathies. But he said when they give it to people, they seem to regrow their organs. It stimulates stem cells to regenerate. He sent me 2 cases the same day. I picked it up at the airport, injected it into these 2 people. Within 2 weeks, they regrew their livers. Dr. Barter was so impressed that he came out with a team of doctors from Washington, D.C., from our government, to examine the patients and set up a national conference on organ regeneration. And he asked me to be the lead speaker. The chiefs were not happy with me. They said, we asked you to watch these people die. Now they're alive and well. We told the families they'd be dead in 2 weeks. You made us look like fools. And you also use a drug that wasn't on a formulary. I said, well, the formulary committee doesn't meet for 2 months. Yes, you could be fired for this. And they probably would have fired me. But Dr. Barter took me under his wing, and he and I gave it to 79 people all across the country waiting for liver transplants. And 75 out of 79 regenerated their livers within a month. And I was appointed the Food and Drug Administration principal investigator for alpha-lipoic acid as a drug for the reversal of all forms of liver disease. Then I got a call from one of the large, well-respected medical centers, and the chief asked me if he thought it would reverse diabetic neuropathies. And I says, originally that's what it was meant to do. And I sent him many cases. We kept these lipoic acid samples at National Institutes of Health. We sent him all of these samples, and I never heard from him again. Then a few years later, I read this article that this group gave intravenous alpha-lipoic acid to 1,200 people who were waiting for who were waiting, possibly have their toes amputated. Within 3 weeks, they grew new blood vessels, new nerves in the toes, did not require amputation. And I thought, well, finally become a prescription drug. They stopped doing it. This is back in the early 80s. So I called a drug company, told them I was the Food and Drug Administration principal investigator for intravenous lipoic acid as a drug. I asked them, why did this group stop using it? And they had such wonderful results. He said, off the record, this place is a big place. They have thousands of employees. They have all sorts of equipment. They have several hospitals. If they regrow the toes, if they grow new blood vessels, new nerves on the toes, they lose the patient. If they cut them off, they make a lot of money. Then next year they come back and have a foot amputated, then a lower leg, then an upper leg, then the other limb. This drug was bad for their business. That's why they stopped. They have to do expensive surgeries to stay in business. If they regrow the toes, they lose the patient.
You know, the cliche profits over people, it's not just a cliche. This is your own experience.
From my experience, I've seen this to be true in many cases, not in all cases. So then I asked the vice president of the drug company, I said, are you going to put it on the market as a drug? You had such great results with it. He said, your drug will never get on the market. I said, why not? He says, well, if we give it for diabetic neuropathies, it also very effectively lowers blood sugar. We lose money on our diabetes drugs, our insulin. He says, you've proven that it regrows livers. We lose money on our liver drugs. It gets in the heart, dissolves the plaque. We lose money on our heart drugs. It seems to stimulate the stem cells in the lungs. We lose money on our lung drugs. It changes cancer metabolism from anaerobic to aerobic. Cancer cells die from that. We lose money on it. This is the worst drug that has ever been around. Your drug will never get on the market. And a few weeks later, I got a letter from the FDA saying, we're sorry, but you're no longer the principal investigator for this drug. We're dropping lipoic acid as a possible prescription drug.
And they gave you no other reason as to why they let you go?
No, they said that I wasn't sending in enough reports. And as I remember, it's a long time ago, I would send a report in, and they sent it back to me and said I sent it to the wrong place. So I sent it to the place they suggested. They sent it back. That's the wrong place. You have to send it to another place.
Yeah, so it's all just a game.
I think so.
So talk about this story that you shared with me off camera. But of course, we're not going to get into too much detail, but it's just important, I feel, for people to hear this as well, about how you were subjected to a lot of pressure, generally speaking, but this one case in particular where you were ordered to give something to a woman that you knew she was allergic to. It was going to be a bad result. You refused to. Tell me the story behind this.
Well, one night when I was on call, I received a call from the chief of medicine, and he said, would you please give this woman an injection of a certain drug? I think it was quinidine. And I said, she's allergic to it. He said, I asked you to give her the injection. I didn't want to hear any flack from you. Well, I'm not going to do it. He said, you're not going to take the orders from the chief? No. He says, I just can't understand how difficult you are. You're the most difficult resident we've ever had. And I said, I'm not doing it. So he asked another resident to give her the shot, and she died right afterwards from an allergic reaction. So that the next morning when I came to work and doing my rounds, one of the nurses came up to me, and she handed me a sheet of paper. She said, this is the original record that this other resident gave a shot and the person died. She said, when the chief came in, he asked me to alter the record and make it look like you gave the person the injection and the person died.
Wow.
And I believe this is a felony.
Yeah, there's no doubt. The reason why I think it's important for people to hear a story like this, one, that records do get falsified, but more importantly, you talk about this one. What was it about the year for the 60s, 70s?
This was in the late 70s.
The late 70s. You fast forward even to today. I know a lot of people that go through medical school even recently, and it's a pervasive culture that we've talked about a lot, where doctors feel like they have to follow orders or else. And it's that mentality that's given to them that people wonder, why are they getting treated this way as patients? Because it's if the patients don't follow orders, they're literally getting kicked out of medical practices now. This attitude is pervasive throughout, Western medicine since the beginning of time, isn't it?
Well, I think, originally when I started medical school in Chicago, I was told by one of the professors, this is a club you're getting into. Everybody does the same thing. Nobody gets in trouble. I said, what about new ideas? Maybe if somebody's really stubborn after 50 years, it'll get accepted.
And this is before you're a medical doctor, correct?
Yeah,
He's laying down the law for you.
Yeah. And I really got so fed up with medical school that I quit originally and went to the university, got a master's degree and a Ph.D., and became a professor of microbiology at Rutgers University, where I was for several years. Then it was later on that I decided to pick up the 2 years of medical school I didn't have, the hospital years. And I thought I'd never practice, always thought I'd be a professor. But I thought I'd have a lot more power at the university and earn a lot more money and be able to protect myself from the medical establishment.
Now, this next story, Dr. Berkson, I think is going to be, I can't think of another word except unbelievable. Nobody's going to imagine that it can get this ugly. But you were treating people successfully with serious liver problems. And it seems to me, when we spoke about this off camera, like they were throwing you these cases because, bottom line, the simplest way to put it is they had to see that you would get people that would die on your watch to make them feel better. Now, what I just said is just, that's impossible. No medical doctor in their right mind would want to see a doctor fail. But Tell me a little bit more about this story. It seemed like these people were really bothered that you had a clean record at this point in time that I'm describing.
Well, before I discuss this, I wrote a book called about lipoic acid breakthrough. And Dr. Julian Whitaker wrote the foreword to that book. And what he said, when I was young, I thought if something new came along in medicine and it was very effective, it would be immediately accepted by all doctors and it would become standard of care. He said, now that I've been practicing 30-some years, I realize that most doctors would rather have their patients die than do something different. And I think most doctors are afraid of anything different. But there are exceptions. There are exceptions. I think the culture is be quiet, behave yourself, go through your residency, do everything like everybody else. You earn a good living, and you'll never get in trouble.
You thought for yourself a lot. You were critically thinking, and it's definitely not something that is well received within the Western medical system. Is that fair to say?
Well, I had been a professor before I became a doctor. And I had 8 years of education above an MD before I did the hospital work for the MD. And it's very difficult for a person like this to get along.
Were they looking for these what were you describing, these black crow parties?
Well, at many medical schools, in many hospitals, university hospitals, they give an award every month to the doctor who has the most deaths on his service.
It's unbelievable.
And they have a party, and it's called a Black Crow Award. And I was told I'd never win the Black Crow Award. I said, great, I never want it.
So having gone through all these incredible stories, and your experience is really amazing, let's break down for people the different kinds of liver disease that are out there so people have a clear understanding, Dr. Berkson, what's going on.
Well, there are many kinds of liver disease. There's liver disease caused by viruses, like hepatitis A, hepatitis B, hepatitis C, and several others. There's liver disease that's caused by a terrible diet, which is fatty liver disease. There's liver disease that's genetic, all sorts of liver diseases. But alpha-lipoic acid seems to stimulate the stem cells in the liver and other organs to regenerate, and we often see that we could regenerate a full liver even if a person has early cirrhosis.
You mentioned before that alpha-lipoic acid as a drug. It's not considered a drug, though, today, is it?
Well, today it's considered a nutraceutical, but originally it was a experimental, investigational prescription drug.
And now, as far as you know, there any government health agency looking into this substance at all and how it could help people further?
Well, it's a natural product. People have published on it already. I have many publications and peer-reviewed journals on it. The reversal of liver disease, and a reversal of some cancers. There are many studies now trying to change the alpha-lipoic acid molecule by changing part of the molecule so it can be patented as a new drug. But it seems that all of these corrupted molecules don't work as well as the original molecule. Lipoic acid, the reason we're alive is because every one of our cells is producing alpha-lipoic acid now in small amounts. And it converts your food into energy. So without it, we'd all be dead. It's the reason that we have energy to live. And many people don't understand this. There's a enzyme called pyruvate dehydrogenase. And lipoic acid is the major part of this enzyme. It's the key to changing our food into energy. When people are sick, they're not producing very much of it. A little child produces tremendous amounts of alpha-lipoic acid.
So this is self-generated in the human body, correct?
Yes. Every cell of your body's making it now. That's why you're alive, in small amounts. A little child produces tremendous amounts of it. You feed him a Thanksgiving meal, he'll be running around the house. An 80-year-old man hardly produces it anymore. You feed him a Thanksgiving meal, he'll be sleeping on a couch. Unless you give him alpha-lipoic acid, he'll be walking around the house.
I've even heard that this can help with people, not that we want to encourage people to drink, but I guess with the toxic effects of drinking, the next day with hangovers and all of this, the point is if there's more of that alpha-lipoic acid present in the body, it has a protective effect, correct?
Exactly. It seems to reverse hangovers. We have people with full-blown alcoholic cirrhosis. They come from all over the world. And we reverse it. They have alcoholic cirrhosis, they have portal hypertension with a big belly, their muscles are degenerating, their livers all looks like a prune. They go on alpha-lipoic acid and a few other things. 2 years later, they look like a normal human being again. They regenerate their entire liver.
And in Western medicine, if someone presented with those kind of symptoms, what's their approach at that point in time with that kind of a person?
Liver transplant.
That's it. And just hopefully they're going to survive until they get the transplant.
Exactly.
So we hear this term NASH, N-A-S-H. Can you break this down, explain what it is, and help us to understand it? Because we're not all cellular biologists.
It's a fatty liver. And people get this from eating terrible diets. And many people eat fast food every day. They drink sodas every day with a lot of sugar in them. And the liver can't handle it. So it starts laying down fat. And after a period of time, it becomes fibrotic. And if they continue this, eventually it becomes cirrhotic. And they form these little patches of scar tissue and nodules all over the liver. And then that could even turn into hepatocellular carcinoma, liver cancer.
So for those that might be curious, can you just define what NASH is?
Yeah. Non-alcoholic steatohepatitis, which means fatty liver.
Oh. And so, again, we hear, as we're breaking all this down, we hear a lot about hepatitis A, hepatitis B, and C. What's the difference between these?
Well, hepatitis A is something that people get from eating food that's contaminated with a virus. And it's usually self-limiting, and they usually get better. Hepatitis B is a virus that could be very, very dangerous. Surgeons often contacted by somebody's blood that contains the virus getting through their gloves. Their glove might break and they get a cut, and that's how they get it. Hepatitis C, I say the majority of our patients get hepatitis C from blood transfusions in hospitals that contain the virus. Many people get it from intravenous drug use, but I think there's a lot more of this going on in hospitals than people realize.
Yeah, what you just said at the end kind of, I think, may surprise a lot of people. Hepatitis C coming from blood transfusions. Wouldn't you think, maybe it's naive, that in a hospital, they're giving you a blood transfusion, the blood is clean, it's been tested. How on earth could it have a virus? Can you explain that?
Did you ever see the people lining up at one of these blood donation places?
All the time, and on an intuitive level. I'll be honest with you. I hope people take it the right way. It's just my own personal decision. I've always been really squeamish about these places. Like, I don't understand. I guess a lot of people don't think about this at all, but tell me, what's the story?
I see a lot
these?
of homeless people standing in line, and I think they test the blood to some extent, but I think some samples contain the hepatitis C virus. And I published a paper some time back on 3 people with hepatitis C, early cirrhosis, and with my triple antioxidant treatment for liver disease, all 3 within a short time, I'd say a little over a year, completely regenerated their livers. And that's alpha-lipoic acid, orally and intravenously, selenium, which seems to be a birth control pill for the hepatitis C virus. Dr. Will Taylor at the University of Georgia published some papers on this sometime back. It's completely ignored. And selenium, it's silymarin, which protects the liver from further damage. This was published in the German Journal of Internal Medicine. And when our government saw this, they wrote an abstract of it and sent it to all the doctors through PubMed.
So you mentioned the triple antioxidant therapy. You mentioned the 3 elements. It's great. But I would imagine, based on the person that's in front of you, intravenous, oral, different amounts. Can you break it down for us? How do you know how much to give people?
Well, usually we start out very low as far as the intravenous, because we don't want to make anybody sick. We start out with maybe 20 milligrams.
Well, there was one thing you just said that was interesting right there, though. What is it that could happen to someone if you gave too much? Is it about mobilizing too much toxic debris into the body?
No, the big problem is that lipoic acid was originally a drug for the reversal of diabetes and diabetic neuropathies in Europe. And it still is a prescription drug there, and also in South America and Italy, a prescription drug for the reversal of diabetes and diabetic complications. It lowers blood sugar very effectively. So if somebody doesn't have food on board, they could have hypoglycemia. That's the main problem we've seen. They have to eat first.
Are any of the people that you treat with this, or would it be advisable that they're on blood sugar lowering medications at all, or do you preferably remove them from that medication? I mean, how do you negotiate around that?
No, what we do is if somebody's a diabetic,
right,
and they're on diabetes medications, we give them the lipoic acid dissolved in D5W in a glucose solution. We follow their blood sugars very carefully.
And what would be the difference between IV versus oral administration? What would be the criteria as to why you do that?
When somebody swallows lipoic acid orally, it's immediately goes into the portal vein from the digestive tract straight to the liver. It's absorbed very, very quickly. In fact, people say, well, maybe this stuff isn't absorbed into the bloodstream, is a certain product, but you could smell it in the urine in 15 minutes. So it gets right into the bloodstream very quickly. And it all goes to the liver. So that's good. It's orally. But when somebody's sick with cirrhosis, they have free radical damage all over their body. And if you just go to the liver, you're only partially treating them. If you do it intravenously, it crosses the blood-brain barrier, goes into the brain, goes into the heart, it goes into the lungs, it goes into every part of the body. And besides doing what I said originally, that it turns food into energy in the mitochondria. It clears out all the cobwebs that have built up. All the free radicals are neutralized, and people start feeling well right away. This is something that our body produces that keeps us healthy.
It's amazing. So if someone were really in a bad situation, and I'm sure people listening to this, Dr. Berkson, there are some really serious cases out there. Their liver is just about shot, serious fatty liver disease. They decide to get this kind of therapy. What does it actually look like? Is it every day? How long does it take? Do they have to take a break? Do they have to go somewhere and sleep over? That whole thing. Break it down for us.
Well, our patients come from all over the world. We have people from South Africa, from China, from Japan, from Thailand, from South America, from all over the United States. And we usually ask the people if they have a local doctor who could continue treatment, especially with certain forms of cancer. We published several papers, several case reports and series on the reversal of stage 4 cancers. Somebody will come into the office. We work them up. We do blood work. And let's say they have cirrhosis of the liver, alcoholic cirrhosis. We start the lipoic acid slowly, lower dose. We make sure they're not hypoglycemic. Make sure they don't have a low, they don't have enough sugar.
I'm sorry, is this the ALA only or the triple antioxidant therapy?
This is the ALA only.
Got it.
The selenium and the silymarin are oral.
Got it.
And eventually we build up to probably an average size individual to about 600 milligrams. And they may stay from anywhere from a week to, one person, one of the Grand Khalifa from North Africa came in. He came to the United States with diabetic neuropathies, couldn't walk, diabetic retinopathies, and he came to a big medical center on the East Coast, and they told him nothing could be done. He was finished. And one of the doctors there said, "Don't tell anybody, but I think I know somebody who could help you." And he flew out to Las Cruces with his whole entourage of about 30 people. He has his sons, his bodyguards, his cooks. And he stayed for 6 months every day. And when he left, he was able to read and he was able to walk.
It's incredible. What regenerative power. Would you say that in a lot of cases, though, that seems like a tricky part, to find a physician that will help where they live? Do you work with those doctors if they're open-minded enough? How does that look,
Well, many of the doctors that belong to ACAM and to some of the other integrative organizations are willing to do this work.
So when it comes to the selenium and silymarin, how much do you give of that? Is it one dose or it depends on the person?
Depends on the person, but once we build up to the oral dose we want, usually 600 to 900 milligrams a day orally, divided doses of lipoic acid, and 200 micrograms of selenium, and probably about 2,000 milligrams of silymarin every day in divided doses.
And so besides blood sugar drops, is there anything else that it just seems like an amazing therapy that so many more people should be using, should hear about? Well, I think we understand why maybe a lot of people don't hear about this, but are there any other things that people should be concerned about depending on their health condition if they were to get this therapy?
Probably not. I've been doing it for over 40 years now, and we really haven't seen anything with a good German product. There are other products that might be very good, but sometimes they're not. You have to be very careful. Dr. Barter and I did the original work on alpha lipoic acid intravenously in the United States, and we gave it to 79 people who were liver transplant, possibly waiting for liver transplants. 75 out of 79 regenerated their livers within a month.
And every one of these people, there was nothing else that they were going to do, conventionally speaking.
There was really nothing else for them. They were liver transplant candidates.
So autoimmune hepatitis, let's change gears for a moment, and lupus. Two different things. Break this down for us.
Well, originally, autoimmune hepatitis was called lupus hepatitis. It's, when the body attacks an organ with a positive anti-nuclear antibody, this is lupus. If it attacks the kidneys, it's lupus nephritis. If it attacks the liver, it's lupus hepatitis or autoimmune hepatitis.
So the body is actually recognizing normal organs as a problem or an enemy of the body.
Yes.
It's crazy.
Yeah. And one of the things we use for that is low-dose naltrexone. Many years ago, about 20 years ago, a man came into the office, and he came in with a walker, could hardly even move. He said he had been at MD Anderson Cancer Hospital, and they told him he had prostate cancer in his bones, and he also had rheumatoid arthritis and systemic lupus. And he said the MD Anderson people said he had a few weeks to live. He had to put his wife in a nursing home before he died. Would I give him pain pills so he could survive for that amount of time without a lot of pain? I said, sure, I gave him the pain pills. Then he asked me if I ever heard of Dr. Bahari in New York. I said, no, I never heard of him. And he said, he heard Dr. Bahari was stopping the growth of cancer and reversing it, and reversing rheumatoid disease like lupus and rheumatoid arthritis. So I said, well, why don't you go up there and see him? He said, he's just in a little office. If he's any good, wouldn't he be at Sloan Kettering or Dana-Farber? I said, they treat a lot of cancer. They don't cure a lot of cancer. And I told him how when I was in Cleveland, they were very angry with me because I was regrowing livers rather than sending them to be transplanted. I said, I'd go up there. So anyway, this gentleman went up and saw Dr. Bahari, and I thought he died. 3 years later, he walks in without his walker. And I said, John, how are you doing? He said, I'm doing fine. I have a cold or sinus trouble. So what about the cancer and rheumatoid arthritis? He said, Dr. Bahari put me on low-dose naltrexone, which costs about $20 a month. And that stopped the growth of the cancer, reversed it. And the rheumatoid arthritis disappeared.
What is that substance for people who don't know?
Well, high dose naltrexone was a prescription drug that they gave to narcotics addicts. So they didn't feel the narcotic. But low-dose naltrexone does something else. If you take it at bedtime, in the morning there's a cascade of endorphins, endogenous endorphins, natural opiates. One group of them downregulates cytokines that cause inflammation. Another one, named metenkephalin, binds to cancer cells and kills them. But I was very skeptical. I had a lot of patients with rheumatoid arthritis, systemic lupus, and the majority of them got better with low-dose naltrexone.
But what exactly is it? Where does it come from?
It's a prescription drug. And it's compounded to lower doses by compounding pharmacies.
And there's any risk at all that people should be knowing about? I know you've been using it for a long time.
Yeah, I take it every night. Everybody in my family takes it to prevent things. Once in a while, somebody tells me they have vivid dreams. They dream that they're an astronaut and going to Mars or something like that. Vivid dreams, the side effect. But I've never had vivid dreams, though, with low-dose naltrexone.
So talk about some of the papers that you've produced, because for those who are more scientifically inclined and they want to see, look, this is all nice what you're talking about, Dr. Berkson, but come on. Did you publish anything about this stuff that we're talking about?
Oh, sure. Originally, I was a microbiologist and a mycologist. We published a lot of papers on the cell biology of fungi and other microorganisms. In fact, I published a paper many years ago on how a nucleus moves through the cell. And I said the centriole is the organelle of nuclear motility, and it was published in the Journal of Cytology. Once I got into medicine, my first publications were with Dr. Barter from National Institutes of Health, published out of National Institutes of Health, probably the most prestigious place in the world for publications. We published on the reversal of acute hepatic necrosis, the worst form of liver disease. And let's see, I think we have 3 publications on that.
And just to repeat what you just said, the reversal. These people reversed this condition and felt completely fine. You've done this.
The people I've followed are in their 80s now with no liver disease. Then I thought if it works for acute liver disease, would it work for chronic liver disease? And I published a paper on 3 people who were on liver transplant lists. Within a year, I'd say, they were free of liver disease. And I published this in the German Journal of Internal Medicine. I was a visiting scientist in Germany, and we published it there. And when our government saw it, they wrote the abstract, and it was on PubMed, and it was available to everybody. Then I started, a man came in, a young man who was an MD Anderson patient who had pancreatic cancer metastasized to his liver, stage 4. Young man, 44 years old, young wife, young son. And he said he didn't want to die, and they told him to go to hospice. I said, "You want to try this?" I said, "Yes." And we gave him the intravenous lipoic acid, low-dose naltrexone at bedtime, and a few other things. 2 months later, I went back to work. 9 years later, the PET scan showed no cancer.
And this is no other thing. I mean, don't let me put words in your mouth. No other major changes to these people's lives. Obviously, they're not running all over the place and eating fast food and doing all these things in that condition. But essentially, these were the very safe and effective therapies that were put into these people.
No side effects at all.
To help them regenerate their bodies.
Yeah. So then a man came in, I think he was a retired policeman from Chicago, and he had a lymphoma and a possible leukemia. He was also told there was nothing that could be done. And we put him on lipoic acid for several weeks, and then he just followed up with low-dose naltrexone. And 6 months later, the PET scan showed no leukemia or lymphoma. Then I published another paper in a peer-reviewed journal of 3 more people with pancreatic cancer metastases of the liver. Within a short time, they were free of it. And then I published another paper on a stage 4 renal cell carcinoma, kidney cancer metastasized to the lung. It took 4 years for him to get better, but he was feeling better very soon after treatment. All published in big peer-reviewed journals. And then we published another paper on actually how much lipoic acid it would take to kill a person. And I did the electron microscopy at the university on that. And it seems that if you have very, very high doses of lipoic acid, the mitochondria starts working, it gets overworked, and heats up and blows up. So that's 90 milligrams per kilogram. Those are the LD50 studies. And
that's an enormous amount you just described.
But I was very surprised that one day I received a call from our National Cancer Institute in Washington, the most prestigious place in the world for cancer. And one of the directors called me up and said, we've been reading your publications and you're having wonderful results. Can we invite you to Washington and teach us what you're doing? And I went there and talked, and there were no arguments. And then one of the directors told me, he says, this is very interesting, a metabolic approach to the reversal of cancer. He said, but I don't think it'll catch on. There are the drug companies don't want to see this kind of thing on the market.
What a shocking revelation.
He said, but maybe if we have a Great Depression someday, people won't be able to afford these expensive types of treatment, and this kind of thing will be accepted. So a few years later, he called me up and he said, I think the president's spending too much money, and he thinks if his colleagues get in, we might have a Great Depression. So we'd like to invite you back to Washington. We'll give you an entire afternoon to speak at the National Cancer Institute, present 7 cases of stage 4 cancers you've reversed, liver cancer, pancreatic cancer, kidney cancer, breast cancer, 7 cases of serious cases, and we will have our experts listen to each case and then discuss each case after you present it. So I went there, spoke for the whole afternoon, and they said, hey, this is all valid. And they wrote this big newsletter up and sent it to all of the doctors in America from National Institutes of Health and National Cancer Institute, the most prestigious place in the world for medicine. And cancer doctors weren't happy. The ones I ran into said, you're not an oncologist, stay out of our business. The hepatologists and liver doctors told me the same thing. I don't know why they invited somebody like you. You haven't been trained to do things the way we do it. We use chemotherapy. We use other immunotherapies, and we're happy with what we do. We don't want to hear from somebody like you.
It sounds just like with Linus Pauling. He's not a medical doctor. Why is he messing around? Countless biological dentists who I've spoken to who know that if you clean up the mouth, you'll clean up the body and the person will feel better. But Western medicine views a dentist that speaks about that connection. They're crazy. Stay out of our business. This happens over and over again. It just sounds like Dr. Berkson, there's a lot of people, unfortunately, in the profession that feel very insecure. And I know I'm being gentle and nice about this, which is not my intention. They're very fearful of being sued, and they're looking to just protect their own financial interests and forget about the way this will actually help people out at all.
Well, first of all, let me say that I don't think we cure any cancers. I think we often cause cancer to regress. And as long as they're doing the treatment, they seem to be doing fine, probably in the majority of cases. We have a lot of terrible failures, too, I have to tell you that. I don't know why. Maybe it just isn't working, or it's possible the person's not following the protocol.
You remind me of my the late, great Dr. Nicholas Gonzalez, a dear friend of mine, who would say that a lot of times he would do a lot of therapies with people successfully where it wasn't necessarily something that he wanted people to understand, that just like what you just said, it didn't cure the person of cancer. They still had cancer in their body,
sure,
but they felt better. They were active, participating with their family, feeling so much better, and lived many, many more years with the presence of cancer cells. But the bottom line is they were much healthier. I think that's what you're saying.
Although we have one woman from Odessa, Texas, who came in maybe 12 years ago, who had breast cancer metabolized to her bone and to her liver. And she was also told by the university that there was no hope she should go to hospice. And we started treating her with our program. But every once in a while, she went back for some chemotherapy. She never looked bad. She she taught school all through this time. It felt normal. And, lipoic acid seems to neutralize the free radicals that chemotherapy produces. So what I told her, I said, if you're going to have chemotherapy, that's fine. I mean, I always tell my patients what they could do conventionally and non-conventionally. So go ahead and do it if you want to do this. But a few days after the chemotherapy, after the chemo kills the cancer, you don't want it to hang around with and kill everything else. You get the lipoic acid and neutralizes the excess chemo. So she did that, and now it's 13 years later. There's no sign of cancer. She stopped treatment, and she seemed to be cured.
So as we're closing out this discussion on liver issues, it's amazing what your experience has shown you and how many people you've been able to help. It's not 100%, we understand that, but talk a little bit more about, at your center in New Mexico, some of the other therapies that people would be exposed to that help them with their liver dysfunction.
Well, with liver cancer, by the way, what we usually do is we give them intravenous vitamin C in the morning. Then they go out and they have something to eat because they need food on board. And they get lipoic acid in the afternoon. And when they get their vitamin C in the morning, the vitamin C gets used up. But the lipoic acid recycles it, so they get like 3 times the bang for their buck if they do it that way. And we've had very good results with this. We have several people who've had hepatocellular carcinoma, and I think one of the cases I presented at the National Cancer Institute, where we were able to reverse that in 2 years. There was no sign of that after 2 years.
I hear a lot of noise out there from, I'll say this in a nice way again, people who maybe don't know what they're saying, but you got to watch out with that vitamin C. It can cause kidney stones and all this danger, and you really should be getting vitamin C from just natural sources like an orange or food. But, I find it a hard thing to communicate to those people sometimes, that they got to realize these people that you're seeing are really not feeling well at all. There's no practical way they could get enough vitamin C in them by eating, 500 oranges a day? I mean,
that's right. Yeah, we go up to 75 grams a day.
That's a lot of vitamin C. 75,000 milligrams of vitamin C. And the purpose of that is what? What is a good function for that type of individual? Obviously, it's not for someone like me. It's not a pressing need for it. But for someone like that, why? Why that much?
Well, in very high doses, when it comes in contact with cancer cells, it creates free radicals and they die. Cancer cells don't have the enzymes to break that down properly.
Most critically ill patients, this would probably be fair to say, are very deficient in vitamin C, true?
I think so, yes.
And so the alpha lipoic acid goes in the afternoon, and are there other therapies that you do to help people to feel better and recover?
Well, let me tell you exactly what alpha lipoic acid does for, let's say, a cancer patient. You remember I said that lipoic acid, one of the things it does is it converts the food into energy.
Right.
There's an enzyme called pyruvate dehydrogenase, and it contains, it's a tricyclic enzyme, and each part of the enzyme is a lipoic acid molecule. Now, cancer cells create an enzyme that interferes with this pyruvate dehydrogenase. This is actually called pyruvate dehydrogenase kinase. Lipoic acid downregulates that. So the cancer cells don't know what to do and they die.
Right, so they're basically turning off that cancer cell's ability to do harm to the body.
In other words, the cancer cells are forced from a anaerobic metabolism, a very simple, sluggish metabolism, into a aerobic metabolism where the mitochondria are involved. And since their mitochondria are not functional, they die.
So Otto Warburg talked a bit about this whole concept for making cancer cells not want to be around in your body. Just a lot of presence of the oxygen and all of this. This makes so much sense that a person should expose themselves to anything like that would calm down inflammation, bring in more oxygen to the cells. This would be just a win-win, right?
Well, he won the Nobel Prize for that. A funny story. Every year I go to the national cancer meetings from one of the big universities. And last year, I was walking by the booth from this university, and a young female oncologist handed me a tray of Hershey bars and Three Musketeers and M&Ms. And I said, I can't understand why an oncologist would be passing out sugar. She said, why do you say that? I said, because cancer cells need sugar to live. They grow on sugar. She says, I don't believe that. I said, you don't? I says, what about Otto Warburg? I never heard of him. I said, did you ever hear of a PET scan? Of course. Well, why don't you tell me what it is? Well, I take sugar and, oh my God, I never thought of it.
Yeah, so there really is, I've often said that in so many of my programs, Dr. Berkson, that there is this huge disconnect in so many of these medical professionals who are being taught in the medical schools. We've talked about that already. And yet there is such great research. You've been a part of it personally, putting out great information. All this scientific literature is out there to help medical professionals make the connection. But there's just this huge gap between science and what they're doing clinically in their practices, right?
Yeah, people have said to me, well, why aren't you doing large-scale clinical trials? I said, I don't have billions of dollars to do that with. It takes a lot of money. I have a medical practice. I work several days a week. And I just don't have the money to do that. It's very, very expensive to do an FDA, a double-blind placebo-controlled study.
And people need to realize that a lot of this, the engine behind all of this, are large pharmaceutical companies. It's their vested interest is in doing these things for drugs that they're going to sell. And I think that's the toughest pill to swallow, pun intended, that people need to realize that a lot of what we're talking about with the hope of the general public being, well, they'll come up with something to help me out or my family. But the reality is these companies are really looking as to how to profit from making more of these chemicals and not necessarily what's best for the public.
But you have to understand their point of view, too. If they spend $1 billion to study a drug and the drug goes on the market, they don't want to lose that money. That's a lot of money. And you can understand why drug companies are the way they are. And, the stockholders don't want them to lose money.
But it truly is a sick care system, and where they're all taught one thing, this line of treat and manage. I think the whole idea within a few years, you probably will never hear a conventionally trained medical doctor ever talk about a cure, quote unquote, for anything. It's like next to impossible to even fathom such a thing. You've got to diagnose, treat, and manage. And that's where the business is. That's it.
That's the business. But, there are a lot of prescription drugs that are just wonderful. And I use them every day for my patients. But there are a lot of them that are worthless and have terrible side effects and don't work.
Dr. Berkson, thank you very much for your time today. Appreciate it.
It's a pleasure. Thank you.
I'm sure you would agree Dr. Berkson is truly an extraordinary physician. The world needs more doctors just like him. Up next, I'd like you to meet Jessica Miner. Jessica has an incredible personal story to share with you about how a surprising diagnosis of autoimmune hepatitis completely changed her life. And especially if you or someone you love is a busy mom, Her message is extremely important. After you hear from Jessica, I'll introduce you to her health coach, Denise Otten, who was instrumental in literally bringing her back to life. I know you'll gain a lot from this conversation. Jessica, thank you so much for coming. I know you drove a long distance to be here, so I really appreciate it.
Sure.
Why don't you start off by just telling me, when you were first diagnosed with autoimmune hepatitis?
Back in 2014, I was diagnosed and had some things go on with my health that were very scary.
I mean, before you ever didn't feel well, right? I mean, this was leading up to 2014, I would imagine. You didn't know anything about autoimmune hepatitis, did you?
Not at all.
So, walk me through that a little bit, because I think if people really hear your story, it's going to wake them up big time. Because, and I don't mean this in any offensive way, it was pretty much like average, right? I mean, the way this all sort of was going along, if I mentioned to you in 2012, 2013, you looked like you were developing autoimmune hepatitis, you probably would have said, I'm crazy, right?
Yeah. I mean, I was working out 3 times a week and thought I was in tip-top shape. And then probably over a 2-week period, my health started declining rapidly. And I had yellowing of the eyes and the skin, and did some blood work. One of my good friends is a chiropractor, and did a little bit of blood work, and my 2 liver enzymes were extremely high. And you have 2 main liver enzymes, your AST and your ALT. My AST was 1,100 and my ALT was 1,500.
Which, again, for those people who aren't familiar, that's really high. But besides that, right, take me back a little bit more, because I think, before that, it would be helpful for people to realize, I think a lot of people in your situation, they can relate to this, would sort of just think, all right, stress, or I'm not feeling too well, but not think much else about it, and then not really think about it at all. What were some of the other things that were happening to you when you say your health was kind of breaking down over time?
So my hair was falling out, which is hormone imbalance. The yellowing of the skin and the eyes, and some stomach issues. My stomach just didn't feel right. I was very bloated, and just a lot of different symptoms that, looking back, probably over a year's time, were happening. And my trainer even noticed I started going downhill a little bit in the gym, struggling, and so.
And when you were going to see the doctors during this time, were there many visits to the doctors?
No,
what was that experience like?
I never went to the doctor, but when I got my blood work, of course, I went to see an internist over in Mobile, and they did, EKG, chest X-ray, gallbladder ultrasound, and everything looked fine. So they couldn't really figure out what was happening. And, a lot of times they test you for mono. That was all negative. And so they sent me home, and with no answers.
That must have been very, very frustrating. Were you getting the sense from them, I'm just curious, that as they were doing all this testing and they're coming back with nothing, did they think that did they say to you, there's nothing wrong with you, that it's all in your head? I mean, what was that like, the way they were talking to you?
Well, the last, the doctor that was making her rounds the morning they discharged me because they couldn't figure out anything, she said, maybe you got bit by something. But my chiropractic friend, when she saw my blood work, said we could be dealing with an autoimmune. So I did have a little bit of an idea that it was an autoimmune, but I didn't know, which one. So when I came back, I started, getting on some liver supplements and, doing some things. And I did, a cleanse, and just started gradually changing a few things. And my enzymes were coming down. But the doctors wanted to do a liver biopsy, which scared me and I didn't want to do. So when I went in to see them to see what my options were, they said, well, we'll do the liver biopsy, but it's really just going to tell us if you have scarring, and we don't think you have scarring because it came on so rapidly. So I thought, well, then why do it? And I said, well, will it change my protocol that you're going to give me? And they said, no, we'll still put you on the same protocol. So I'm like, okay, well, what is the point of having a scary procedure done like that? So I elected not to do that. And they monitored me, and finally my my antibodies started creeping up, and they felt comfortable diagnosing me with the autoimmune hepatitis.
Interesting.
So, but before that, during that time period is when I started doing some research. And my friend who's a chiropractor, she had me on some things, but there was just something missing. And so as I was researching, I came across a lady named Denise Otten. And she had a few videos online that I watched, and her daughter had what I had. And so I thought, wow, she was talking about this vitamin protocol with alpha lipoic acid and glutathione, and, so I thought, gosh, she's got to be on Facebook. And so she was, and I sent her an inbox, and she immediately messaged me back. I told her what I'd been doing, and she helped me, fill the missing piece.
So you were doing all this research, which sounds like the healthy switch for you. Mm-hmm. You're getting frustrated with conventional Western medicine. You start taking your health into your own hands and checking things out. What was the shift for you? What made you decide? Because we're going to be talking to Denise very soon as part of this event. Mm-hmm. So I'm looking forward to that conversation. But what made you shift to, okay, I'm going to use a holistic health counselor?
Well, when the doctors told me what medication I was going to be on and the side effects of it, I think I was going to have to have my platelets checked once a week. It caused cancer. You were just life altering. So I decided it made more sense to change the way I was eating and put back into my body the things that it was lacking.
I think this is it's a critical moment, if you don't mind me saying it this way, and I'm sure you understand what I'm about to say. So many people, they don't feel well, health is falling apart, but in my over 30 years in the health and fitness industry, I have heard more, what I'm about to say, way more than listening to your story today, which is that people, their health falls apart. Mm-hmm. They go to the doctor, and they constantly think to themselves, how can I make any decisions about my own health care? Even though I'm falling apart, my health's no good, even if the doctors that they're going to are not helping them that well. Mm-hmm. But they still say to me, for decades I've heard this, what do I know? I've never gone to medical school. They're the experts. I've got to just listen to them. And for so many people, I'm going to say it this way, they're so scared to actually make decisions like I'm sensing that you made about going to a holistic health counselor, to making these changes for your own health. They're more scared to make those kind of changes to see how things go than just stay with their illness, feel lousy, and stick with what the doctors tell them. You know what I mean?
Well, I feel like doctors, the liver doctor that I saw, they're wanting to treat the symptoms, which is the high liver enzymes. They're not looking at what is causing them to be elevated. So when you do blood work, food allergy testing, your analysis, it's really going to break down everything that's going on with your body, show you what you're missing, and then to me, it just made sense. Okay, well, if I can fix these issues and put back the nutrients that my body needs to function properly, I don't know, it was just a no-brainer for me.
So how long did this take, this whole process now? Or take me back, I guess, to maybe the starting point. Is this 2015 now where you started with the Holistic Health Council and really started making big moves?
Let's see, November of 2014. So yeah. And the liver doctor, after I found Denise and I started, doing this protocol, the liver doctor said, wow, I've never seen liver enzymes drop this rapidly, because he was following me. And so he was amazed, and I, of course, I told him what all I was taking and doing, and, of course, he didn't want to acknowledge that that was a good way to do, because all he knew was to, treat the symptoms with this medication.
Interesting. Let me just interrupt you for a moment. So you're describing these things that you're doing, making changes to your food and supplement routine?
Mm-hmm.
Okay. So you're explaining this. He's testing you. He sees that things are dropping in a favorable way. You're doing better in his eyes, medical test-wise. What does he turn and say to you when you say he didn't acknowledge? Did he just say nothing at all, or was it more of a feeling like, I'm not interested, or what was it like?
He was very nice about it. He actually, I saw two liver doctors. One of them was retiring, and this other one was, following him. The other liver doctor that was retiring was like, this is crazy. When I told him I was doing the cleanses and things like that, but the younger doctor was nice, and he said, if it's working for you, then, keep doing what you're doing.
Wait, I'm sorry. So the older doc said it was crazy what you were doing, or crazy the results that he was seeing?
No, crazy what I was doing.
Wow.
Yeah. So,
so he was just so ingrained into his quote unquote system that this was just like you were Martian.
Yeah. But the younger doctor was, he was very nice and saw that I was, getting good results. But he did comment on he had never seen somebody's liver enzymes drop so rapidly for somebody my age.
And help me out with this. I won't ask you how old you are. But from the point that you were diagnosed and you had these elevated enzymes, right? Mm-hmm. How fast, what period of time was it that you had this big drop in the enzymes?
Probably 6 months, and then a year they were in normal range.
Wow, that's fantastic. And can you describe a little bit more what you were doing?
So I eliminated wheat, dairy, corn, and added, some alpha lipoic acid, B complex, selenium, omegas, CoQ10, because my heart was, looking back at my blood work, was not in great shape at the time. So I ate a lot of fat, healthy fats, avocados, coconut oil, and my joints, everything felt better.
It's interesting.
And I did try, it was funny because about 6 months into it, when I started feeling well and Denise had me, on the strict diet, I kind of thought, well, I could use this granola bar. I could try these. And so I bought a package of them. And I think it was getting close to checking my enzymes again, and it hurt my stomach and, caused an increase in my liver enzymes. And so I realized that I really had to follow this special diet until, forever.
What was some of your favorite foods when you say wheat and stuff? It's great. Why don't we identify for people, right? Because I think a lot of people don't think of certain foods that they eat all the time as being that harmful for their health. So what were some of your favorite foods, that you were just always eating? You say wheat, corn, but what did it look like, The
Aunt Jemima pancakes, her syrup, bread, nature's own bread off the shelf.
So a lot of flour products.
A lot of, yeah. And what's funny is before I was diagnosed, I've never really been a big bread eater, but I was craving a lot of wheat before I got sick. So now, I've changed from that to almond flour and pancakes and real maple syrup and
but I
just
think it's
made little
interesting.
changes like that.
You were very physically active, though, as well, burning up a lot of sugar. So I think it's different for everybody, right? But it makes a lot of sense that as an exercise physiologist, my background, I don't know if you know this, was in training high-performance athletes and doing a lot in physical fitness. It completely makes sense that you would be, describe your exercise routine. I'm only guessing, but go ahead, just tell me what it is.
It was very intense. It
Right.
was pushing sleds and lifting weights, running sprints. It was a very hard workout. But it's all what you put in your mouth. It's 80%, 80% of what you put in your mouth, 20% exercise. Because I was working out hardcore, 3 times a week for an hour and a half. And,
Yeah, one of the worst things I've ever heard in my life is no pain, no gain. I think it's a ridiculous thing in physical fitness. But what I think is great about your story, and I know you're going to relate to this, is physical fitness-wise, wow, you're doing a lot physically. And that's great. I have no problem with that. But physical fitness and the health of somebody can be, in many, many cases, so different. I've known high-performance aerobic athletes who've run miles and miles, week after week, for years. And then you hear these stories of them having cancer because of the free radical damage. So yeah, they could do incredible minutes per mile on the road and run like crazy, but their health suffered. Or the famous story of Jim Fixx, who was a high-performance American all-star runner, and he was eating just horrible food and drops dead of a heart attack. It's health-wise is a very different thing than just your fitness, and I'm sure you would agree with that.
Absolutely. And people think that because I'm thin, I'm healthy, and I was very sick. Genetically, I am thin, but yeah, it has not a lot to do with weight.
And so what happened now? You're feeling better. All of this is happening within 2014, those months and in 2015 go along. But then I think, like most people are going to relate to what you're about to say. I know that you said you kind of got comfortable or feeling really good and just kind of relaxed a little bit. Can you describe what it was that went on for you then? What did you kind of let go of in your routine? You must have thought, hey, I'm doing great. I don't need to do this anymore. What?
I don't know. I just felt so good that I felt like I can introduce back some of the foods that I used to eat, and it didn't work.
What were some of the things you started to do?
Well, the granola bars and what else? Sugar, brownies, ice cream, things like that. And
it's not like you had, excuse me for saying it this way, but it's not like you had a box of cookies or anything like this. You just started to indulge a little bit. I'll have a sweet here and there. And you were exercising all along this time. So again, those cravings, the sugar, and our habits are hard to break. You just started drifting back a little bit to that, right?
Once you truly change your diet, you don't crave those things anymore. When everything is balanced right, then you don't crave those things.
So what happened then? Now you're loosening up the way you're eating a little bit. What did you notice happen?
Stomach. My stomach was not right, and my liver enzymes were creeping back up. So that told me that it was time to stay on the strict diet.
Jessica, I got to jump in here for a second and just ask you again about this thing with granola. Your granola story, I think, is very important for people to get, because here it is, you're doing really well, I'd love for you to speak to where your liver enzymes were at. And then you just go off a little bit with this granola. How much were you eating of granola, and for how long, until you then quickly realized it was getting really bad for you? Please talk about this.
So my liver enzymes were in normal range in the 20s. And, of course, I've got 4 kids, so I'm running crazy with their schedule. So I thought I needed a snack to keep in the car. So I bought a box of granola bars. And I was probably averaging eating 2 a day. And it was getting time to check my liver enzymes again. And so over about a week's time, I had, 2 a day, went in and had them checked, and they had increased to the 200s.
Wow.
So it, scared me, and I called Denise, and, I said, my enzymes are in the 200 again, in the 200s. And she said, well, what have you changed? What have you done differently? And I said, well, I got some granola bars and kept them in the car and, started eating them. And so we figured out that that's what the problem was. So I eliminated those, and they dropped back into normal range.
And specifically, it was beyond just the number, which is a dramatic increase. Within that few days, that week, did you physically feel different?
Yeah, I started, my stomach was bothering me again, and didn't have the energy, and just felt a little sickly, bloated. So that was always a sign to me when I felt very full. Was kind of a sign to me that my enzymes were elevated.
And just to be clear, so people don't walk away confused, granola. Mm-hmm. What do you think in the granola bars was what was really, giving you a lot of problems? What ingredients? Was it the oats? Was it the wheat? Was it the sugar combination?
Combination of everything. Mm-hmm. So, there's a lot of, at least from what I've read, a lot of research with pesticides and leaky gut, which leaky gut is what I had, which, led to the autoimmune hepatitis. And so those pesticides in there just really are harmful to our stomachs and cause leaky gut. And then, of course, the wheat is very hard to digest. So, moving to gluten-free and the rice, it's just easier to digest. But I found that with snacks and things like that, carrots and kale and things like that, are easy to keep with you. It's a lot of planning as well. You have to plan, when you go on trips and you're in the car all the time. So preparing and planning helps.
So now in looking back, obviously a lot of people might be wondering as they're listening to you tell your story, what do you think actually caused the autoimmune hepatitis to begin with? What was going on?
A lot of stress. I have 4 children. During that time, the loss of 3 parents, financial ups and downs. And then a year before I was diagnosed, I started working. I'd always been a stay-at-home mom, so I got into a network marketing business, and I was traveling a lot and just running on adrenaline. And my adrenals were also depleted. So I crashed.
It sounds like you were burning the candle on both ends.
Yes. And it just caught up with me. Years of stress, and, when you're in that fight or flight, 12 hours a day, it really is harmful. So I learned to take time for myself. Self-care, I feel like, is a big part of health. And so it's hard with 4 kids, but you've got to make that happen.
Yeah, a lot of times I'll use a story, an analogy, if you will, of like, when you go on an airplane and people can understand this right away, they'll tell you, if, God forbid the plane's dropping, right? What do you first do, right? And the air pressure is being lost. Put the mask on yourself first and then take care of your own children. So in listening to a story, I think it's a very important message that I want to really emphasize is that what you're really saying you learn for yourself is that, the stress that we hear about all the time, the mental, emotional stress, we all have to deal with it. But it's to really be very careful, especially when you don't feel well, to appreciate how truly destructive it is and that it's okay to take time to take care of yourself. Doesn't mean you're a narcissist or you're thinking only about yourself and you don't care about your children anymore because you're making time to make sure that you're okay so that you can be of better service to your kids, right? I mean, is that fair to say what I'm saying?
Absolutely. Yeah, you've got to take care. I mean, I need to be here for my children. So taking care of myself has become a priority.
So in closing, what would you say to people who are perhaps sense or already do know that something's going on with their liver? I mean, whether they're poking the right side of their body and they feel that pain in there, or they have thinning hair or just stressed out, and these things that you talked about today, what would you say to those people if they're sensing like, wait a minute, maybe something like this is really going on with me and I've got to do something? What would you say to them?
Listen to your body. Your liver is your most vascular organ. And so it will rejuvenate itself, when you do the right things. So, just take care of yourself and listen to, even when you eat things, how you feel afterwards, and how your body responds to what you've, put in your mouth. And look for symptoms and don't wait.
Yeah, I've often said that people, and I know this is so easy to overlook, I've said it many times on hundreds of programs I've created over the years. You know what you need to do. When people say, oh, I'm so overwhelmed now, I'm getting all this information, Jonathan, I don't know what to do. I'm even more stressed out in a sense, having listened to all of this. I don't know. I often say, and I'm not trying to blow it off, I often say, you do know what you need to do. It'd be really good if you just pay attention to what it is that you are hearing most of the time that you need to do. And if you just listen, you'll have a pretty good idea what the next thing is to do. I'm sure in your case, there were a lot of next things you needed to do, and you're always still listening. What is it I've got to do next, right?
Right. It is overwhelming. I was extremely overwhelmed. I knew I needed to eat healthy, but it's where do you start? So, just starting with breakfast, changing your syrup, from one that has high fructose corn syrup to the real deal that actually does have nutrients in it. And so just changing little things like that aren't so overwhelming, because people do get overwhelmed when they feel like they have to change everything at one time.
Now, you've gone through a lot. Another thing that I was just thinking about when you were talking is when someone is so stressed out, if they'll just stop for a moment, take a deep breath, and just make that decision to do that one thing, which, again, I don't think is such a little thing you just said, which I think a lot of people listening might blow off and say, oh, that's silly. Change maple syrup from one with high fructose corn syrup to a cleaner, organic, real version of maple syrup. But in doing that, you are moving towards cutting down your stress level, because that's literally taking greater control of your life. Is that fair to say?
Yeah, absolutely. Yes. Baby steps.
Jessica, thank you so much. I know this is couldn't be easy, right? Because you're asking to come on camera and tell your story. And I know you drove a large distance, to be here. So thank you very much for being with us. I really appreciate it.
Thank you for having me.
Okay, now I want you to meet Jessica's health coach, Denise Otten. Denise will outline how to avoid becoming a liver transplant statistic. Plus, you'll discover which nutrients are a must-have for liver health and a hopeful message filled with solutions for anyone dealing with cirrhosis. No doubt, a good health coach can help you overcome many health issues. Enjoy my conversation with Denise Otten. Denise, thank you very much for being part of this program. I know you for many years, and you are the only holistic health counselor we've got on this program.
Oh, I'm so excited. Thank you. I'm honored.
Yeah. So I know that in your past life, you were into the financial world, doing all of that. And then the way I'll put it is your whole life must have changed, right? Upside down when your daughter got diagnosed with autoimmune hepatitis. Can you take me back to those days many moons ago? And what happened?
So if I start to cry, it's only because I am reliving it. And as a mother, you always want your children to be very healthy. So I was a mother of 3 and working at a very prestigious, one of the largest Wall Street firms in America, in the world. And I was really trying to do the best I could as a female financial advisor. And I had 3 children at home that I had to do the best I could with being a mom. And at 7 years old, my daughter, youngest, contracted autoimmune hepatitis. And it was one of those things that you go, what's that? It was, we were at a talent show at her elementary school, and everyone noticed that her eyes were very yellow. And since she has beautiful, big blue eyes, you can tell the contrast with yellow in her eyes. So I rushed her to the doctor the next day, and I didn't think it was anything because I figured, oh, well, she just has a little jaundice, maybe we give her some vitamin D. And she said, and he said, they tested her, and she has autoimmune hepatitis. And I went, what? Now, mind you, I went to the best pediatric hepatologists in the New York, New Jersey area. And I thought that we had the best doctors in the world. So we went, they had her diagnosed as autoimmune hepatitis, and they told me that she would have to be on many years of immunosuppressants, Imuran and prednisone. And everyone knows what happens with prednisone, how it gives you the moon face, and it alters your blood sugar, and it alters your body. It really does alter your body. It makes you fat and hairy. And for me, that was pretty incredulous since I had come from a holistic background. I really always thought that eating properly and exercising was good for you and you would have a good, healthy life, and I thought that I was doing that with my children. But, of course, like all the mothers in America and in the world, I was giving them fast foods, and I was giving them pizza and Chinese food and lasagna and pasta, and bagels, and bread, and sandwiches. And the combination, Jonathan, of having my children, I was fully compliant with vaccinations, and I vaccinated the children, and I also had food that was sprayed with glyphosate because I wasn't organic back then, and I had all the foods that were from the standard American diet, and I don't think that helped. So it was a combination of all the toxicity in the air, earth, and water, and she got autoimmune hepatitis, and I was shocked. My husband and I couldn't believe it. And because the thing about autoimmune hepatitis is the minute that you get that diagnosis, you think they're going to die, because hepatitis conjures up the concept of cirrhosis of the liver transplant, and death. And honestly, I was beside myself with fear, and I was crying every single day.
So I know sometimes you've talked to me in the past, Denise, about how you get upset about this whole experience that you had with some of the doctors that you were working with. Why don't you just talk to me a little bit more in detail about what that was like and, just what triggered you then to just go, alternative, even though I don't really even like that word, alternative, but you know what I mean. Go in that other direction other than what conventionally trained doctors were telling you had to do for your daughter.
Okay, well, in 2003, my daughter was diagnosed with autoimmune hepatitis, and I didn't want to give her those medications because I didn't want to put her on prednisone for a long period of time. And they said 5 years on these drugs, then she'll be fine. And I said, well, let me go and check the internet, see if there's any alternative treatments. So I went on the internet, and in those days, if you remember 2003, you had Ask Jeeves and you had Yahoo, so we really didn't have much of Google or any kind of information on the internet back then, and I couldn't find anybody who had alternative answers for autoimmune hepatitis, and I had to listen to the doctors. So I listened to the doctors, and you have to understand, I was very into fitness. My husband was a bodybuilder, and the doctor who we went to was obese. So for me, it was very difficult for me to listen to him and believe what he said was accurate because he wasn't the picture of health. However, he had an MD and I didn't, and I had no other choice. And my daughter was very, very ill. So I had to listen to him. And I couldn't find anybody anywhere on the internet that had any answers. So I listened to him for 4.5 years. And he was apparently one of the best in the New York, New Jersey area. And I went to him and we gave her prednisone and Imuran for 4.5 years. And she seemed to be doing better. And I thought, oh, this guy's brilliant. Then in the 5th year, he said, the drugs are not working. We're going to have to give her alternative meds. So to me, that meant stronger drugs. And I went, oh, hold it a minute. I'm not doing this anymore. You know, this is not right. You told me 5 years. And I started getting a little heated with him. But I said, you told me 5 years. He said, well, it's not working. So we're going to have to go a little with stronger meds. And there might be something else in the future. He was intimating that there could be a liver transplant in her future if these strong drugs weren't working. And the strong drug that he wanted to give her was Cellcept. I was hysterical. I had to be calmed down, but we had to do what he said. So I said, okay, we're going to do it. And I got the prescription and I filled it. And I sat at the breakfast table. I'll never forget this. I'm sitting across from my husband. I decided to read what the side effects were on Cellcept, and I'm reading them. I said, honey, we cannot give this to our child. It causes lymphoma. That's the first thing. And he said, well, then what are we going to do? I said, I don't know, but I'm going to figure this out. And I told the doctor, I'm not ready to give her the Cellcept. He said, no, you know what's going to happen, Mrs. Otten, intimating that she was going to have a liver transplant. And I said, well, if I don't try to find an alternative answer and I just give her the drugs and she has a liver transplant, I'm going to just kill myself because I won't want to live. And he said, but we have no other choice. And I said, well, let me try. And if I'm wrong, I'll come back to you. I promise. And I went on the internet, and within a month, I found an alternative treatment. I found one woman in Texas who healed herself of autoimmune hepatitis naturally. And she had all the books and all the doctors and all the references. And she was almost dead, and she healed herself. And I called her, and she sent me all the vitamins, and she gave me a list of doctors to go and research, and a list of books to go and research. And that was the beginning of my journey. And God bless her, she was the one who helped guide me because she had the protocol. She had already done it. And she introduced me to other people and doctors who I had appointments with. And eventually, in 4 months, on the vitamin protocol and the strict diet, my daughter was well after 5 years on drugs.
Wow. You know, I mean, there's a couple things that you talked about just there, Denise, I'd like to get into a little bit more because I think it's going to be worthwhile for people to hear this. You know, one, the doctors are saying they have to give you something that's experimental. You're saying it's a stronger drug. The only thing I'm thinking is they have less data on these drugs that they want to give your child. And two, when the doctor kept saying to you, well, what are you, crazy? You're going to go do anything else? Really what they're saying is they don't have anything else. It doesn't mean that there isn't something else out there. And I want people to really appreciate this. I don't think that they're evil people. I think they genuinely mean what they're saying. There isn't anything else out there. But I think it's just important for people to maybe hear it a little differently if, God forbid, this is ever said to them. What are you, crazy? Don't do anything else other than what I'm saying because there isn't anything else. Really, I think a healthy way to hear that, and I think a more accurate way, is just to remember they don't know anything else. But it doesn't mean something else doesn't exist. And in your case, that's very true, right?
Yes, and I think that for most people, they've really, the doctors that I have dealt with in the past, they really did believe that they were doing the best that they could for the child. The problem is that they refuse to think outside the box. They refuse to do the research that I did and read the books that I read. And I didn't go to med school, but nobody cares about your kid more than you. Nobody. I don't care who it is. Maybe the mother and the father. Those are the most important. And nobody's going to care. And if you're an adult with autoimmune hepatitis, nobody cares about you more than you. So it's up to you to be your own patient advocate. And it's up to the parents to be the patient advocate of the kid. And the doctors are just going to do what they were taught in med school. They are only taught pharmacology and surgery. They were not taught nutrition. They don't even have training in nutrition in med school. So how can they then say, I have the experience, if they've never read a book about nutrition? They never read Gary Null. They never read Dr. Burt Benson, who is the father of alpha-lipoic, who is going to be in this documentary and is one of the utmost brilliant people in alpha-lipoic and how to reverse certain autoimmune diseases with it. So there's a science there. Guess what? Learn the science. And there's also other things that you can do, but you really need to know that the food has changed in the last 100 years. And our food sources have become less healthy for us. So we need to supplement with the missing vitamins and nutrients that are not in the food sources. And also the food is, sprayed with glyphosate and they're GMO, so you have to go as organic as possible. Do the best you can if you can't do organic.
We're going to break down those things as we continue to talk, Denise. But before we get over this point, I think it's important also for people to realize some of the stuff that you were saying is so valuable that they don't learn what else to say to you except for what they talk about, pharmacology, refer to a specialist, surgeries, more drugs. But they're also trained in subtle and not so subtle ways in medical school. Don't question. This is our system. And I'm not saying it again judgmentally. I'm saying it, I know you can appreciate what I'm saying, so that when people listen, they can remember this again. God forbid they ever go through this themselves. That they experience when they're in medical school, it's like torture, mental and emotional torture, conditioning and training. Don't question the system. This is what we're teaching you, and we want you to recite this. Literally, they'll come out and say this. Many times I've heard this. We want you to tell all your patients this way only and nothing else. And so when they come out of training, it's not necessarily they even think about it. That's the way they treated you. How did you feel? I mean, talk about that a little bit before we get into the details of what you did for your daughter and how it really helped her to feel so much better. Talk about how they treated you, what they were saying to you, and what your feelings were in terms of they're telling you to just stick to their system, and now you're going to break away. Weren't you scared? Did you have any doubts in yourself?
You're addressing a couple of different issues.
Yeah.
First of all, you do get bullied into, doctors are taught this is what it is. It's black and white, and there are no other ways around it. I was always trained in the school of life, because I'm a woman in business, so I have to think outside the box to sell myself so that a guy will hire me and treat me like a peer. So I have to always think outside the box. I was a financial analyst on Wall Street, so I had to think outside the box and find the right investments for people. And then as a New Yorker, I say as a New Yorker like it's a badge of courage, but the truth is every American is just as tough as every American. The Texans and the Southerners and the Eastern and the people in California and the people up in the Midwest, we're all tough Americans. And I'm sure they're very tough in the other countries, but we are taught to stand up for your rights. We are taught to think outside the box, because that's America. We are taught to be kind, but be tough and question authority. And that's the part that saved my daughter's life, is that I kept questioning him and questioning him.
I was going to say also,
him.
The thing about being tough is that if you don't do these things and look out for yourself in a non-selfish way, you'll lose. Mm-hmm. So that's the part, too, I'm hearing from you that's really important. It's a valuable thing for all of us to be like. Question, wonder, seek out the information that you need so that you can win the game.
Right. And our parents were very obedient and they followed the rules a lot. And I think that the people who came after them, we didn't follow the rules so much. We were a little bit, combative and we just questioned authority a lot, which is why the internet exists, because they questioned authority, right? Whatever you think about the internet, I saved my daughter's life. But I think that people just have to, in general, they have to think outside the box. And yes, you get the diagnosis. Yes, you listen to what the options are, and then you have to make your own choice. And that's not to say to always go against the medical system. That's just to say question people. Does it make sense to you to take a drug that's going to suppress your immune system so that you could obviously going to get sick more often? No, that doesn't make sense. What we want to do is build back the immune system that is deficient and figure out why, go down the timeline, figure out why you got deficient in the nutrients. And yes, there's a genetic predisposition, but that doesn't always hold water. It's not that you're sick, it's that you're toxic. So find out why you're toxic and put the nutrients back in. Find the doctors and the holistic practitioners out there that have the answers to reverse your issue. And everyone's different, Jonathan. Everyone heals at different rates. But this particular protocol and vitamin and nutrients that you put into your body, and obviously change of diet, is going to help. It's going to heal, not just help. It's going to heal and reverse many different liver problems, many different autoimmune problems. But as I said before, it regenerates the liver. It regenerates, I'm going to say it 3 times. It regenerates the liver. It doesn't just reverse it. It regenerates a cirrhosed liver. So it's very possible. And as you'll find out in all the interviews that you do with all the different doctors, they've done it 24/7 for decades.
Yeah, I know it's hard. People listening to this, I'm putting myself in their shoes. They're listening to this, of course, in my own heart. I hope that as people listen, they feel more self-empowered, they feel more confident. But in reality, I know that most people won't feel that confident like you, Denise, until they actually do something and experience the difference for themselves. Mm-hmm. I want you to get into what you actually did for your daughter to save her life, literally. But talk a little bit also about this book. You wrote a book, Curing Courtney. So please, tell me about it.
So as I said, I healed my daughter of autoimmune hepatitis with the diet and the vitamins. She was, from 7 years old, she got sick, and then at 12 and a half years old, we reversed her in 3 months. And I was I got to tell you, honestly, I have a very strong faith. And I was on my knees, and I prayed to God every day. And if this would work, God, I'm going to tell everybody, and I'm going to honor you every way I can. And for those of you who don't believe in God, that's okay too. Whatever you believe is the strongest source. But what I found is that with the diet and the vitamins and the strong belief system in the person who's healing, that's going to help them reverse this. So we gave her alpha-lipoic from a very good source. You can't get alpha-lipoic from China. You have to get it from it's got to be sourced from Germany or from Italy. We gave her silymarin, which is also called milk thistle. We gave her selenium. And with alpha-lipoic, you always have to have B complex because alpha-lipoic absorbs your B complex. So you have to have the two of them together. Those 4 were the critical vitamins and nutraceuticals that actually regenerate and support the liver. But then you have to also support the immune system. So we gave her your basic vitamins, your B, your C, your probiotics, your fish oils, and so on. And the key was food. Food matters. I can't emphasize that enough. No wheat, no dairy diet. That's the fundamental diet right there. Try and go organic as much as you can. Lots of proteins, then vegetables, then fruits and seeds and nuts. Grains are not as important as everyone tells you that they are. Yes, you could have your potatoes, that's no problem, and your root vegetables, but you've got to take the wheat out of your diet. If you don't, then you're going to end up just hitting yourself up against the wall. Then you're buying vitamins that are too expensive, and they're not going to work because you're eating the wheat, and the wheat is just going to make your liver sick. Why? Because it's inflammatory. There's a lot of reasons. Read books like Wheat Belly and Grain Brain and all those books that explain to you why the wheat is inflammatory and detrimental to your health these days. So this is what actually reversed it in 4 months. Now, granted, she was a fast healer. Not everybody heals in 4 months. Most people it takes anywhere from 6 months to a year if they only have autoimmune hepatitis. If they have multiple things wrong with them, like maybe they have Lyme that is misdiagnosed as autoimmune hepatitis, or maybe they have an extreme toxic element in their body. I mean, I've seen people who were, they had such pollution in their body that it was hard to chelate it out of their body. If they were freshly vaccinated with travel vaccines, it takes years to chelate that out of the body. But also, if you have somebody who was a farmer's daughter or somebody who lived on a farm where glyphosate was sprayed all the time, it's so hard to get that out of the body. So you have to move away from the farm, get yourself into a clean environment, and then do the diet and vitamins, and then it works a little more efficiently.
So what if somebody were to say to you, well, I eat organic, I don't have the chemicals, Denise? What do you say to people, especially those that maybe want to hold on to that organic wheat or organic grains? What's your response to that?
Well, it's your choice. I'm not forcing you to do this. If you would like to reverse your autoimmune hepatitis, I'm here for you, and we can work together, no problem, but you got to get off the wheat or it's not going to work. And if you want to, then stay with it and call me when you're ready. And I have often told people, just call me when you're ready, because you got to get serious if you want to get healthy. There have been people that didn't listen to me and went all organic and figured it out by themselves because they were just so broke they couldn't afford some of the vitamins that I told them, and they ended up doing well. And then there's, of course, the people who just call me back and say, I couldn't do it, and, can you help me? But there's a lot of different grades of how sick you are. Sometimes autoimmune hepatitis is not autoimmune hepatitis. And I've spoken to Dr. Berkson about this. I said, did you know that sometimes people have candida and it's actually misdiagnosed? Excuse me, the pronunciation is candida. And I realized that with certain people, after they don't get well in 6 months or so, I noticed that it's probably not that. There's a trigger that's making them worse. So through process of elimination, we realize, and some testing, we realized that it's candida. We put them on the candida diet and the candida protocol, and they get better. And the jaundice goes away. And they're 100% better. And then they go back on sugar and they get sicker. So everyone has triggers also, Jonathan. So wheat is a trigger. And as you heard Jessica Miner tell you that she had a trigger of the oats and the granola bar and maybe the glyphosate. Oats have been a trigger for some people that I've worked with also. One woman was perfectly compliant, and for 2 years she couldn't get her AST and her ALT to come below 200. And we had another conversation, and I said, let's talk about your diet. And we went through it. She said, oh, by the way, I am eating a bowl of oatmeal every morning. I was like, you forgot to bring that up. Let's eliminate the bowl of oatmeal. Call me back in 2 weeks after you've gotten a blood test. And her liver levels went from 200 down to 50 in 2 weeks because she eliminated the oatmeal. Another boy, not a boy, he's a young man now, had autoimmune hepatitis for 14 years. And he couldn't get his liver levels below 200, even though we had taken him off all the drugs with all the vitamins. He still couldn't get to the 20s. And he finally said, you know what? I think I'm going to get off beans because I've been eating, and I've been reading that lectins are not good for you. I said, absolutely. Lectins are bad for you. They're wheat. Wheat is a lectin family. And he said he got off beans, and then weeks later, his liver levels went down to the 20s, the first time ever in 14 years. So for him, lectins were the culprit. So everybody has to find their trigger. And that's something that I help them do.
So, I mean, it's an incredible story already, Denise. But then on top of that, you do write the book, Curing Courtney. What inspired you to write a book? Because I know that's a big project, right?
It was a very big project, but also a labor of love. And for many years, I was telling people, did you hear that I healed my daughter of autoimmune hepatitis with vitamins and diet? And they'd go, oh, good for you. How about those Yankees? And it was like it was like they didn't understand that the child almost died and I healed her with diet and vitamins. Do you get how important that is? And so I got this again and again, people just dismissing me like it was, I opened up a can of soup. And I finally said, I'm going to just write the book, because if I can write the book, then maybe people can read it and understand how important this is. And if I can save one person, Jonathan, then all my efforts were worth it. And Courtney's horrible experience was worth it. And so I wrote the book, Curing Courtney, to tell the world that there's an alternative answer for autoimmune hepatitis. And please read it, and maybe you too can reverse your autoimmune hepatitis. And when I did, all of a sudden, I figured I'll make a few dollars on it, but I didn't sell that many because only people with autoimmune hepatitis buy the book if they're at all interested in alternatives. But people started calling me from all over the world, and they were emailing me and texting me, and I realized there are people out there that I could help, and I started helping them. And then the first woman whose child came to me, she was 8 years old. That child healed in 6 months. A man in Holland who came to me with 12 years on immunosuppressants with autoimmune hepatitis, he reversed it in a year. And they came to me one after another after another. And I just realized that, okay, maybe I better get my holistic health counseling license so I can heal these people and make a little bit of a living, but have a title. So it could be, something that they could respectfully understand that I'm very serious about this. And that's how it came to be. And then it just grew into this business that is about healing people all over the world. And I can say that because now I have like a whole bunch of people in the country of Turkey that come to me. It's amazing. I've opened the door to Turkey. So I'm happy to say that it's really expanding. And what's beautiful, Jonathan, is I touch some people with the experiences, and then they touch others, and they touch others, and we're creating this butterfly effect of a healthy community. So now if you go on curingcourtney.com, the website, or if you go on my Facebook page, Curing Courtney, you can find a community of people who are healthy and happy, and they're willing to share their experiences with you. And I couldn't be happier. I'm really excited. And of course, I have to thank Dr. Burt Benson for his endless work with alpha-lipoic. He has been so, so helpful. And I have to give a shout out to my beautiful woman in Texas who was the first one who helped me. And her name is LaDonna, and she was an angel. She helped me every week. I was calling her. This is not working. How come? be patient, keep taking the vitamins. And I can't thank people enough. Dr. Burt Benson wrote the foreword in my book. There's a second book coming out. It's about the people who healed, so stay tuned for that one. But I think that everyone needs to read a little bit about Curing Courtney, and then they need to read more about nutrition. Wheat Belly, I always tell people to read that book. I always tell people to read The Alpha-Lipoic Breakthrough for Dr. Burt Benson. They really need to research everything on alpha-lipoic. And don't listen to the naysayers, because they're probably trolls that don't want you to get healthy. They want you to stay on meds. There's a place for medicine. There's a place for it. Because when you're really sick and you have high liver enzymes, you do need the prednisone, and you need it fast. But after that, you need to come off your drugs. You need to come off your drugs and get on a vitamin regimen that's going to work.
Denise, I have a feeling after this conversation, you're going to have to get another telephone because it's going to be ringing off the hook. But just take me back again for a second. I mean, your daughter's 7 years old. She gets autoimmune hepatitis. You know, what do you think caused it to begin with?
Well, in 2003, I couldn't figure out. I had my suspicions. And in 2007, it wasn't on the internet. And then about 2017, 18, 19, I figured out, because I subscribe to your network, your naturalhealth365.com. And there's another one that's greenmedinfo.com. And those places and PubMed, and then I cross-referenced it with PubMed.com.gov. I think you have to always cross-reference things to find out that it was a combination. There's not one thing that causes this breakdown in your immune system. I'm very confident that it was some of the vaccinations actually cause hepatitis. So hepatitis B that they're giving the children at birth now actually causes hepatitis. So you could just look that up on PubMed.gov. It's there. And then on top of it, we live in a farmland community. We don't live in the farms. We live in New Jersey, where we all know is the Garden State, and they spray glyphosate. And the glyphosate big push came in the 1980s, I believe. So my children were always eating corn, Jersey corn, July, filled with glyphosate. Little did I know that was important. So then I interviewed Dr. Stephanie Seneff, who's an MIT PhD, and she said, and her 200 pieces of work that talk about glyphosate and how it causes autoimmune diseases was an eye-opener for me. It was a game changer. And I said, she said, it's not just the vaccines, it's the combination of the glyphosate that you have in your system that never goes away, and you pass it down from childhood, from child to child, from mother to child. And then also, all the vaccines that I got and that you got, that made a difference too. And in my case with Courtney, we moved into a new house that had lots of ticks, so I sprayed every year. I had the guys come and spray whatever chemical they spray to kill the ticks, and then I let the kids go on it the next day. You're supposed to get off it for 24 hours, but that's going into their system and on their skin, and they'd play on the playground, they play in the grass, and that too is very cancerous. And it destroys the immune system. So all those things together, with all the bad foods that I was giving them, with the pizzas, and I was a very big pizza, pasta, bagel eater. So I think that all the wheat really made it worse. And all the sugars that I gave her, they have the glyphosate in it too. So I think you have to look at everything. Now here's an interesting, you asked me about me, and that's great, that's my answer. But here's what I've found out over the last 6-7 years that I've been helping other people. It's not just what you put into your body today, it's what your mother and father put into their body, and then it transfers over through the egg and the sperm. And sometimes even the non-vaccinated kids can get the autoimmune hepatitis. Why? Because their parents were in the war, whether it was the Iraq War or in the last 10 years, they got vaccinated because they were soldiers. Then there's the grandfathers that were in the Vietnam War. I have a client who has 6 children, I can't remember if it's 5 or 6 children, in California, and each one of them are autistic, and none of them have been vaccinated. And one of them has autoimmune hepatitis. Why? Because Grandpa, I'm not saying this is the reason, I'm saying one of the factors is that Grandpa was in the Vietnam War, and yes, he did die of certain cancers because they had Agent Orange. So the Agent Orange transfers over to the children and then transfers to the grandchildren. So it's what you have in your system through your parents that you have to clean out of your body. It doesn't mean that it can't be cleaned out. And by the way, I helped that child heal as well, and they're amazed that they don't have to have a liver transplant and he's normal. So there's so many toxic chemicals that we are exposed to that we have to consider that. And then we have to consider the food that we put into our body. And then we have to put the vitamins into our body that can help chelate them out of our system. And then the body can heal on its own. And the autoimmune hepatitis can go away. Sounds like too perfect of a scenario. It doesn't happen like that. But if you don't start doing it, how are you going to heal?
Yeah, I think it's tricky, though, too, what you're talking about for people, because on one hand, you say it could be vaccines, it could be glyphosate, it could be the pesticides, the non-organic food, it could be the wheat, all the different triggers that we're talking about. Why doesn't everybody get affected the same way? And I think that's maybe the mistake of a Western mindset, my neighbor did this, that, and the other thing, and they're fine, and I did pretty much the same thing, and you're telling me I'm sick because of that. I don't get it. That's the part I think that's really tricky. I'm sure you experience that all the time with the people you speak to.
Oh, sure.
Because of the way you described, everyone is so individual. Their genetic makeup,
absolutely,
their level of exposure, how long they were exposed to it, their sensitivity or their predisposition to reacting in an intense way like your child early on versus someone maybe that came from stronger stock, not so overly exposed when they were younger, but then adult onset autoimmune hepatitis because of abuse that they went through later on for 10, 15, 20 years. Yeah. That's why they get sick. So it isn't, you can't make this a cookie cutter answer for everybody.
It's not. So why did one of my children get autoimmune hepatitis and not all three? And they all come from the same mother and father. It's, you know what, everyone has a predisposition to something that they get. Why does my son have no allergies and my other daughters have so many allergies? Everybody is very different, so you treat them differently. There is a general protocol to use and follow, and the foods are very important, but then you have to find out what's just right. You have to tweak what's right for that one particular person. But if I may, it's really also important to note, and this is something that doctors may or may not tell you, but don't be swayed by you have to have this and you have to have that, and you cannot get off those drugs forever. No. You can get off those drugs forever. You may have to be on the vitamins forever, but that's not a bad switch. And I'd rather be on vitamins than medication any time of day. Also, what's really important, if I might, is that everybody reacts differently to it, and also everyone heals differently. I noticed that for liver issues, adult females heal a lot faster if they're not terribly polluted. Children, the girls, heal faster than the boys if they're not terribly polluted. The boys heal the slowest because they have such high testosterone and raging testosterone. Why is that important? Because the liver produces 50% of the testosterone, and boys have more than girls, 100 times more than girls. And men heal slower than women, but they'll still heal. The boys just take a lot longer. And it's okay for them to be on vitamins throughout their lifetime. It's a very healthy thing. And I've tended to boys who are very, very sick, and they had to go on the vitamins, and they slowly came off their drugs. And they still had to stay on a small amount of prednisone, but then their vitamins were, they were still on 20 different vitamins or 10 different vitamins, and they had to stay on a good diet. And they did very well, and they grew big and strong, and they ended up going to college. And surprising the doctors, and they got off the liver transplant list, surprising the doctors. But, I get pictures of them from time to time. Look, he grew and he's bigger, and yeah, I know, it's great. I love it. I'm actually helping to save some children.
So Denise, we're talking about autoimmune hepatitis, and you've been encouraging everybody listening to this that liver problems can be overcome naturally. What about if someone's out there, they already know they have scarring of the liver, cirrhosis? Are you saying that the liver can heal from something like that?
This is a really good question, because I get a lot of people that are afraid to go against the doctors because they said, I have cirrhosis, like it's a badge of honor. Yeah, I know you have cirrhosis. Anybody who has autoimmune hepatitis, and they ask me, have you ever seen that? It's like, yeah. Everybody who has autoimmune hepatitis has either fibrosis or cirrhosis, period. To what degree? Well, but I have stage 3. And I was like, yeah, so what's the problem? What's the question? The question is, can I get over it? Yeah. Listen, here's the news. I need you to go back and research alpha-lipoic and Dr. Burt Benson. And then I want you to come back to me when you're ready to get on the vitamin protocol, because alpha-lipoic, in the many, many decades of Dr. Burt Benson reviewing, and he was the FDA Director of Research for alpha-lipoic for many years, and he explains in research report after research report that alpha-lipoic reverses cirrhosis. So I'm going to say that again, and I repeat it 3 times to them. Alpha-lipoic reverses cirrhosis. That means it takes a very sick, cirrhosed liver that's brown and dead, and it can reverse it and regenerate the cells to become pink. Now, it's going to take a while because you have trillions of cells. So, and you're taking alpha-lipoic by mouth. If you go and get an IV treatment, you're going to regenerate those cells faster. But if you're doing it orally by mouth, it's just going to take a little longer. But alpha-lipoic regenerates the liver. Therefore, and I'm going to say it again because people need to hear it 3 times, alpha-lipoic will regenerate a cirrhosed liver and make it pink and healthy again. And that's the part that doctors are surprised about. They can't believe that the children and the adults have gotten off the liver transplant list. So whether you have fibrosis or cirrhosis, whether it's 1, 2, 3, it doesn't matter. The alpha-lipoic will eventually reverse it. And if you can't see the reversal completely within 6 to 12 months, then maybe what you need to do is get an IV treatment from somebody like a Dr. Benson or another MD who has high quality alpha-lipoic. And you have to get the high quality from Germany and Italy, as I said. But alpha-lipoic reverses cirrhosis. I don't mean to be pithy about it, but that's the science. It is a black and white science today. It may change, and we'll find something even more effective in the future. But for right now, alpha-lipoic regenerates the liver and reverses cirrhosis. 100%? Yep.
And it's important for people to understand what you're emphasizing is that it's already scientifically taken care of. It's validated, it's real, even clinically speaking, for a person like Dr. Benson. I am so honored that he's a part of this event, and I hope people listen to this man over and over again, as well as this interview. But when you're talking about how it's in the science, the problem is people need to just understand that the science is real, but clinically for a lot of doctors, they're just not there. They don't read this science. So when people walk into a doctor's office, they're getting the clinical experience of that doctor, and that's it. So if they don't read the science, if they don't know Dr. Benson, if they've never clinically tried alpha-lipoic acid or any of the vitamins that you talk about, and the food that I'd like you to go into now as well, if they don't do this nutritionally, helping people, then when the person walks into that doctor's office, they're never going to hear it. But again, it exists. So it's real and it exists. It's sad to think how many people, they just don't hear this ever because they happen to be in front of a doctor that just doesn't know anything about this, Denise. Talk about, a little bit more with me, the foods that people should be eating. What's good for people to actually do? Forget about the stuff, obviously, that they should avoid. Fast food, glyphosate, we get it. What about the stuff that they should eat?
Okay, before I address that, I want to just say, when you are first diagnosed with autoimmune hepatitis or any kind of liver disease, you are frozen in time. You freeze, your mind goes blank, and you get fear like you never saw. And there's a PTSD that comes along with it as well. So don't be scared by what the doctor says, and do not be bullied into what you have to do. Just all you do is simply say, okay, I thank you very much for your time, and can I just have a week to think about this? And take a week, 2 weeks, 3 weeks. Yes, you can take a drug if you need to, if you're extremely and critically sick, obviously, but you need to go and do your research. And if you don't go and do your research, then you're not going to get the information about all this, that alpha-lipoic can reverse this. And there's so many alternatives. I haven't even touched upon other alternatives because I don't know about Ayurvedic vitamins and minerals. There's an Ayurvedic protocol that actually reverses autoimmune hepatitis. I just don't know it. So there's a lot of research out there. You just have to find it. Now, as for the food is very important. I always tell people, you got to go on a wheat-free, dairy-free diet. That's number one. That's the most important thing. What does that mean? That means no wheat, no barley. Write this down. No wheat, no barley, no buckwheat. I know buckwheat is a seed, but it's inflammatory. No barley, buckwheat, bulgur. No oats. It's very important to stop the oats. And even though you're going to find organic, gluten-free, just stop it for now because it's an inflammatory grain. We can introduce it later on, but first I want you to get healthy.
What about rye?
No rye. No, nothing that's in the grain, in the wheat family.
And with our macrobiotic background, let me just blurt out the others. Brown rice, millet, those kind of grains.
Okay. So I don't want to take everything away from you. So I want to say, okay, you can take a little bit of the alkaline grains. So brown rice, all right, have some brown rice, just don't bulk up on it. Have some millet, have some quinoa. Just remember that the protein is more important than the grains. Okay, so we want to do your protein, and you want to do your vegetables and your fruits and your nuts and your seeds if you're not allergic. Find out what you're allergic to. Do get a blood test. Don't get the skin test. Get the blood test for allergies, just to find out what you're extremely allergic to. We're not going to take everything away from you. If you're slightly allergic to blueberries, it's all right, eat the blueberries. Just take away the things that you're extremely allergic to. And that's going to cause the inflammation to go away from your body right away. So you're going to have an anti-inflammatory body.
So Denise, this is important. Let me just jump in. I was going to ask you this as well. I would imagine your answer is 100% yes. Should people get food sensitivity testing done because they can uncover these things that they don't necessarily know that they're sensitive to some of these foods that they're eating, right? They may not be aware of it. How important is the testing?
I think it's always good to get a test for food sensitivity because then you can find out right away what you're allergic to instead of trying to figure it out over a 6-month period of time. If you don't have the money to do it, then just don't eat the grains that I said, and you'll figure out if you start to eat. Oh, and no corn. That's really important. No corn, because corn is the 3 worst crops in America that have GMO are corn, wheat, and soy. So if you have to have soy, you have to have only organic, and just don't eat a lot of it.
And Denise, let me throw out some other things because I think this is a great practical conversation for people to hear. So you don't have the money, you don't have anyone around as a healthcare provider, but your tongue is white as can be. You're fatigued. There's brain function issues. Jessica, who's a client of yours who we just spoke to for this event, she talked about her gut and bloating. If your gut is feeling bloated and you just know digestively you're having issues after you eat, there's no fancy medical test going on here, but isn't that fair to say that maybe the thing that you just put into your mouth and you ate within that hour or two, something's wrong, right?
Okay, I'm going to go back to a point that I made before, that Candida is oftentimes misdiagnosed as autoimmune hepatitis. And this is important to note because lots of people, I mean, we all live with Candida on our tongue. It's normal. It's a colony of fungus that grows, dies. You just don't want to have an overgrowth of it, which is caused by sugars. And the sugars are oftentimes because you're eating too many grains, okay, too much wheat. And we're a sugar nation, you know, because it's just ingrained in us that it's okay. So we're not supposed to have too many sugars. So the bottom line is that when you have this overgrowth of Candida in your stomach, you might get bloating issues, you might get stomach issues. But then all of a sudden, you get autoimmune hepatitis and you didn't check to see if your tongue is white. Good point. So stick out your tongue, look in the mirror, and if it looks white and you're not quite sure, Google Candida tongue. And then look at the images and see if your tongue looks like one of those images. So that's number one, to see if there's a Candida issue. The other thing is if you have brain fog. Now, brain fog can be misdiagnosed because brain fog and Candida go hand in hand. But if you have a sick liver and if your AST and ALT are in the 200s or in the thousands, you have brain fog. So it's a little confusing to say it may be Candida. You have to go through the protocol of autoimmune hepatitis. If it works, you're great, because the diet is very good. The diet can kill the Candida. But if you have Candida overgrowth, then the autoimmune hepatitis protocol will not work.
So Denise, as we're wrapping up, I hope people got that your personal professional experience has been to take people who are literally on the liver transplant list, and they're off of it now. Medically speaking, they don't need it. Is that true?
Yeah. You know, whether you're on the liver transplant list or you're not and you just fear that you could be, you really need to make a change in your diet and your vitamins, because everything you've done throughout your life has gotten you to this ill health. So obviously you need to change things, right? So what's logical is change what you put into your mouth and what you put around your body, like the chemical environment, and we can actually change your liver from sick to healthy if you're on the liver transplant list. I can tell you quite a number of children and adults I've taken off the liver transplant list. I had one young boy who actually was flown, I won't tell you which country it was in, was flown by helicopter to get a consultation with the liver transplant team. And I said, don't do it. Just let's get him on the vitamins and the protocol. And within the year, within a couple of weeks, the child was better. Within a couple of months, he was off the liver transplant list, and the doctors couldn't believe it. There's so many situations like that. People who write to me saying, thank you so much for helping me get off the liver transplant list. And I cannot emphasize it enough. What you put into your mouth really matters and will actually make you healthy or make you sick. So get on your wheat-free, dairy-free diet, call me for a consultation, and I'll help you change your life. Now, what happens after I get you better? I'm going to get you all better, and I'm going to get you off your drugs, and you're going to be on a diet and vitamins. What do you do then? Yes, go about your life and go get happy and just have a great time. Will you be nervous that it'll come back? Yeah, you're probably going to have a little PTSD for a while, and if you have a child, mothers and fathers who have children with autoimmune hepatitis get very nervous for many years afterwards because they think that it's going to come back. And I said, if it comes back, no problem. We'll just get you back on the diet again. And if we have a problem with that, we'll just raise your vitamins a little bit. No big deal. We'll do it together. You'll get there. Will you have to take vitamins your whole life? Yes, you will. How many vitamins? Well, everyone's different. You know, some children come off the vitamins and then they don't have to go on till they start messing up their lives and drinking. Some adults can come off the vitamins and stay off and just keep their diet really, really tight. But eventually, all adults need extra vitamins because as we age, we don't produce all these different things in our body, digestive enzymes, we don't produce alpha-lipoic, so you do need a certain amount of maintenance diet, maintenance vitamins.
So it's so interesting what you're saying, Denise, because it's just common sense. If someone were polluting their body with all kinds of fast foods and they never have that again for the rest of their life, they should be okay. If it was from so much toxicity that built up in their body and now they cleaned it up and they pretty much stay away from that toxicity for the rest of their life, that's okay. Or even perhaps if they were hypersensitive to blueberries or strawberries because they had raging fungal overgrowth, but then that's knocked down and everything's good, maybe that person once in a while can have blueberries and strawberries and they'll be okay. But they have to just be careful as they go forward, right? And they decide to eat certain things. They just have to pay attention to how their body is reacting. If they're getting a little trouble in their thinking process, their energy level, they're getting more bloated, they're experiencing some more physical pain, perhaps over their liver, whatever it might be, maybe the tongue is getting more white again all of a sudden, that would be a sign that maybe what they did for the last few days, few weeks, few months is not in the right direction, and maybe they should shift gears again. I mean, isn't that fair to say?
Yeah, and also everyone is so different, Jonathan. And I work with people all over the world, from Pakistan to Turkey to America and even Argentina. You have to really address your issue. So once we get you well and we get you off all the drugs and you have a vitamin protocol, you really have to stay on a certain vitamin protocol for life. Each person is different. As I said, some little kids can come off the vitamins and they'll be fine until they go to college, let's say, and they start drinking, and then we have to get them back on the vitamins. You have to kind of, once your liver is damaged and you have a sensitive liver, you have to honor it and take care of it and stay on an anti-inflammatory diet for life. Yes, you do. Can you cheat once in a while for your birthday? Yeah, just don't go crazy.
Yeah, I love what you're saying about honoring where you came from, honoring where you're at, yep, and honoring what you need to do, rather than this idea that I think is much easier for people to think, which is, oh, Denise, are you telling me I got to live in fear for the rest of my life that autoimmune hepatitis is going to come back? Not really. I'm not getting that from you. Just be honest with yourself, know where you came from, who you are, what your tendencies are going to be, which I would imagine you learn so much more once you feel better. There's nothing like that as a teacher, to know what you need to do from this day going forward.
Right. And you know, it's funny. Women are worrywarts. We really are. It's the estrogen, I think. So we tend to get scared more often that the worst is going to happen. For a female who has children, they might be afraid that they won't be there for the children. Or if you have a kid who's got autoimmune hepatitis, you fear for their lives. And you have to just know that what you put into the mouth is going to make a difference. So let's fix this situation. Let's give you the vitamins in the diet that reverses your issue right now. And then we're going to put you on a maintenance so that the person or the kid can live a very healthy life. But what we're also going to do is teach that kid how to heal themselves. So it's not just about teaching the parents, it's about teaching the child, because once the child is well, they're never going to forget it. They're going to know what makes them feel good. And they're going to be smart enough later on not to mess up their body. Or if they do, they'll be able to correct it. So you will have to be on a good vitamin diet, on a good diet and vitamin protocol for the rest of your life. It just may be different for each person. And remember, Jonathan, you know this. We are living in a different world. The earth, the air, and the water are polluted, and they continue to get polluted. So we have to adjust. We have to change. I mean, you know, when we were Paleolithic, we all didn't wear clothes, and now we're wearing clothes and driving automobiles, and we have a different lifestyle. So now we have to fix our bodies more than before because they are more polluted than ever before. And you can live a very healthy, happy life. You know, lots of exercise, lots of fun, lots of parties, lots of events, go skydiving, fly in a trapeze, do whatever you want to, but just get healthy and know what your body needs. Listen to your body, know what it needs. Get healthy, get your vitamins, and stop eating garbage. Get on a good diet.
Denise, I can't let you go until we just address one more thing, which I know you love to talk about, which is the importance that people need to keep in mind, no pun intended, the emotional side of things when it comes to somebody who's dealing with liver issues. Please talk to me about it.
Okay, and I always tell people this, that confidentially, don't tell anybody, the liver has been known in the metaphysical community to hold on to anger. So if you have anger in your life, and people do get angry, and also children can absorb the anger of their parents because, you know, kids are usually very happy, but they can, if they see a very disappointed or an angry, frustrated parent, they kind of absorb it and they want to help that parent get better, like a little dog. So what you have to understand is that if the liver holds anger, then maybe if we shift our happiness and just have more happiness in your life. How do we do that? Because people go, I have a great life. Yeah, but are you more stressed than you believe you are? So I want you to do me a favor. I want you to sing more, play music, and dance in the kitchen like no one's watching. And if your kids tell you, Ma, you're a terrible dancer, you're a terrible singer, you go, I know, it's okay. And really get happy. Kiss your spouse, pinch their cheek, enjoy your children, and really just love life. Everything about it. Smell the roses and take that walk and really appreciate that you are on this earth, have good food, have a happy life, and if you cannot find that happiness, fake it till you make it because your liver needs happiness. So I always tell people, be happy, 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 and your liver's gonna thank you.
Denise, you made it really clear. I love it. The whole theme of this entire program is to tell people they can have fun, they can enjoy life, and the best that emotions bring for us, right? But the main thing is to keep our head on our shoulders and to think more about what we can do so we can enjoy that kind of life that we want, a happy, healthy life. So, Denise, thank you very much for coming down here from New Jersey, spend time with me here in Florida.
Thank you.
I really appreciate you sharing all of your experience with everybody. Thank you so much.
Thank you so much.
Don't go away, because we have a special interview with Dr. Robert DeMaria, America's drugless doctor. When you're ready, simply click the play button on the extra video you see on this page.